Good afternoon, guys. I have C for you. We are discussing people never reach inpatient rehab that need it. So we're going to discuss that plus examine the reasons why. Okay, so please join me for presentation C. Here we go. My name is Felicia, and I serve as geriatric care specialist in geriatric healthcare system in northwestern Pennsylvania. We care for thousands of Pennsylvanians each year recovering from stroke, traumatic brain injury, spinal cord injury, and other life-altering conditions. I'm here today because too many Pennsylvanians who could benefit from intensive inpatient rehabilitation never receive it. The result is predictable, slower recovery, higher long-term disability, and greater caregiver burden, and higher Medicaid and Medicare spending over time. This is not a clinical failure. It's a systems failure, one that this legislature has the power to fix. The problem: most eligible patients never reach inpatient rehabilitation. Inpatient rehabilitation facilities provide 3 hours per day of intensive interdisciplinary therapy under the supervision of rehabilitation physicians for stroke and TBI patients. IRF care is associated with better functional outcomes, lower readmissions, and greater long-term independence, and skilled nursing facilities, NFS, or home discharge. Yet in Pennsylvania and across the country, only about 1 in 4 stroke patients receive intensive rehab facility care. Only about 1 in 7 TBI patients receives intensive rehab facility care. Many rural counties, including several in northwestern Pennsylvania, have no intensive rehabilitation facility beds at all. This gap is not due to lack of need. It's due to structural barriers in referrals, insurance authorizations, and geographic access. Why patients are not getting the care they need. 1. Hospital referral processes are inconsistent and subjective. Most hospitals lack standardized functional assessments. Discussions often depend on bed availability, discharge pressures, or individual clinician judgment, not evidence-based criteria. 2. Insurers frequently deny inpatient rehabilitation facility care. Prior authorization delays and denials are common. Even when hospital clinicians document clear medical necessity, families often give up rather than fight. Geographic access is deeply unequal. Rural regions, including much of northwest Pennsylvania, have limited or no intensive rehabilitation facility capacity. Patients are discharged to N or SFNs, not because it is the right level of care, but because it is the only available option. Disparities persist across race, income, and insurance type. Research shows that Black, Hispanic, and low income and Medicaid patients are less likely to receive intensive rehab facility care, even when clinically eligible. These barriers compound to create a system where the intensity of rehabilitation, where the intensity of rehabilitation a patient receives depends more on their zip code and the insurance card than on their clinical needs. The human impact. Let me share one example from our health system. A 62-year-old man from rural Crawford County suffered a moderate stroke. He was medically stable, cognitively intact, and highly motivated. Our therapist recommended intensive rehab facility care. His insurer denied the request twice. The nearest intensive rehab facility with available beds was over 90 minutes away, and his family lacked transportation. He was discharged to nursing home facility. 6 months later, he remained wheelchair bound and dependent for most activities of daily living. With intensive rehab facility care, he likely would have walked again. This is not an isolated case. It is the predictable outcome of a system that under delivers the care we know works. Policy solutions. What Pennsylvania can do. 1. Standardized hospital assessments and referral. Require hospitals to use validated functional assessment tools for stroke and TBI patients. Mandate automatic psychiatry consults for those conditions. Publicly report hospital level intensive rehab facility referral rates to identify variation. Protect patients from inappropriate insurance denials. Limit prior authorizations for intensive rehab facility care when clinicians document medical necessity. Require rapid independent review of denials. Ensure Medicaid and commercial plans provide partly with Medicare coverage standards. Expand intensive rehab facility capacity in underserved regions. Create capital gains or loan programs to support intensive rehab facility development in rural areas. Support regional rehabilitation networks to coordinate transfers. Fund transportation assistance for families in rural counties. 4. Access inequities in access. Address inequities in access. Require bias resistant standardized referral protocols. Ensure interpreter services and accessible communication tools. Support caregiver training and respite programs to facilitate intensive rehab facility discharge planning. Align payment with outcomes. And incentivize functional recovery, not lower intensity placement. Ensure bundled payment models do not and inadvertently steer patients away from intensive rehab facilities. What this means for Pennsylvania: improving access to inpatient rehabilitation is not just a clinical issue, it's an economic one. When patients regain independence, they return to work, reduce long-term care or long-term Medicaid spending, and and lessen the burden on family caregivers. Every additional patient who walks out of an intensive rehab facility instead of remaining dependent represents a lifetime of regained productivity and reduced public costs. Pennsylvania has the opportunity to lead the nation in building a rehabilitation system that matches patients to the level of care they need, not the level of care that happens to be available. In closing, members of the committee, the people we serve do not get a second chance at recovery. Stroke and TBI rehabilitation is a race against time. When people miss the window for intensive therapy, we cannot reopen it later. You have the power to ensure that Pennsylvanians receive the right care at the right time, in the right setting. I urge you to act. Thank you for your attention and for your commitment to the health and independence of people of Pennsylvania. I am happy to answer any questions. Okay, now here is the second half of my presentation for y'all. Pennsylvania specific. Okay, so on improving access to inpatient rehabilitation facilities. It is written in your established voice as a Northwest Pennsylvania Health System executive with the narrative, depth, policy, precision, and emotional resonance. You prefer. This one's on improving access to inpatient rehabilitation facilities, folks. Okay, here we go. My name is Felicia, and I serve for people that are elderly. My degree is geriatric care, and the people I see deserve intensive rehab as far as I'm concerned. So here's the rest of my presentation. I am here because too many Pennsylvanians who would benefit from intensive inpatient rehabilitation never receive it. This is not a this is not a this is not a matter of clinical disagreement. It's a matter of structural barriers in referral, insurance, authorization, and geographic access that prevent people from getting the level of care most likely to restore their independence. And the consequences are lifelong. That prevent people from getting level of care they most likely to restore their independence. And the consequences are lifelong. The evidence most eligible patients never reach intensive rehabilitation uh, facility care. A recent multi state study of nearly 445,000 hospitalizations found that only 22% of stroke survivors received inpatient rehabilitation. Only 14% of traumatic brain injury survivors received it. The rest were discharged home to skilled nursing facilities, which provide far less therapy. These findings mirror what we see in Pennsylvania in many regions, including the northeastern, the northern tier, the northwest, and rural central Pennsylvania. There is no intensive rehab facility beds at all. Families are told the nearest intensive rehab facility is 60 to 90 or even 120 minutes away. If they cannot make that trip, the opportunity for recovery is lost. This is not because patients don't need intensive rehab facility care. It is because the system is not designed to deliver it. Why Pennsylvanians are not getting the care they need. Inconsistent hospital referral processes. Without standardized functional assessments, referrals depend on subjective judgment, bed availability, or discharge pressure, not evidence based criteria. Insurance denials and delays. Insurers frequently deny intensive rehab facility placement, even when clinicians document clear medical necessity. Families often cannot navigate appeals before the discharge clock runs out, limiting inappropriate prior authorization is essential. Geographic inequity. Large portions of rural Pennsylvania have no intensive rehab facility capacity. Without capital support for new facilities or transportation assistance, rural patients are effectively excluded. Racial, uh, social, economic, and insurance disparities. Black, Hispanic, low income, and Medicaid patients are less likely to receive intensive rehab facility care. Even when clinically eligible. Standardized, bias resistant referral protocols are needed to ensure equality. The human impact in Pennsylvania. Let me share one example from our region. Okay. A 62-year-old man from Crawford County suffered moderate stroke. He was medically stable, cognitively intact, and highly motivated. Our therapist recommended intensive rehab facility care. His insurer denied the request twice. The nearest intensive rehab facility within an open bed was over 90 minutes away, and his family lacked transportation. He was discharged to a skilled nursing facility. 6 months later, he remained wheelchair bound and dependent for most activities of daily living. With intensive rehab facility care, he likely would have walked again. This is not an isolated case. It is the predictable outcome of a system that under-delivers the care we know works. Okay, guys, so that is your C for tonight. I will talk to everybody later. Maybe jump back on and do a D. For now, Gator Wellness. Take care, folks.